Good morning, students.
Good morning, ma'am.
Good morning, ma'am.
So let's start our today's class. What we have seen yesterday? हमने कल क्या देखा था? क्या कंप्लीट किया था?
Renal test, WBC.
Yes. Well, hemoglobin, hematocrit, then renal studies,
Glucose, blood glucose.
fasting blood glucose, then okay, that all comes under the renal studies. Creatine and BUN.
HbA1c.
Yes, HbA1c and one.
Blood
That-
urea.
Okay, that comes under renal studies, but one is still remaining. Lipids, yes. So let's do a quick revision of our previous class. Yesterday we have completed hemoglobin and hematocrit. What is the normal range of hemoglobin and hematocrit for male and female?
Hemoglobin male 14 to 18.
Yes.
Female 12 to 16.
Okay, online students, what is the normal range of hemoglobin for male and female?
14 to 16. Male and female 12 to 40.
Yes, okay. What is the normal range of hematocrit?
Male 45 to 53.
Okay.
Female 37 to 42.
37 to 47, yes, okay. Online students, what is the normal range of hematocrit for male and female?
42 to 52.
Yes, for
Male
male, okay.
and female 37 to 47.
Okay, for female it's 37% to 47%. Okay, then fasting is required or not for hemoglobin test?
No.
No.
Okay, it is not required. And in which conditions the hemoglobin and hematocrit gets elevated?
COPD.
Okay,
Very high altitude.
Yeah. higher altitudes. Polycythemia. Yes, what is polycythemia? New students will speak.
WBC or
RBC.
Yes, increased number of RBCs. That is called as polycythemia. In which conditions the hemoglobin and hematocrit gets decreased?
anemia.
Anemia.
Hemorrhage.
Okay, anemia and hemorrhage leads to decreased level of hemoglobin, and fluid overload decreases hematocrit. Anemia decreases hematocrit. Hemorrhage decreases hematocrit. Then leukemia,
Bone marrow failure.
bone marrow failure or suppression. So does chemotherapy or cancer leads to decreased level of hematocrit?
Chemotherapy होती थी hematocrit का nature बदल body suppress.
Online students, does chemotherapy or cancer leads to bone marrow suppression or hematocrit reduction? It is not given here, but does it leads to decreased level of hematocrit? Yes or no? If person is diagnosed with any stage cancer and is undergoing chemotherapy, so what are the effects of chemotherapy on hemoglobin and hematocrit? Does it increases or decreases? Online students?
Bone marrow suppress થશે તો decrease થશે.
Yes, obviously, there will be bone marrow suppression. There will be decreased production of RBCs. So there is decreased hemoglobin and hematocrit. That is the common sense. It is though not given, we should know that it happens. Okay. Then we have seen lipids. What comes in lipid profile test? Lipoprotein. Okay, online students, what comes under lipid profile assessment or lipid profile test?
Cholesterol, HDL, LDL ને triglyceride.
Okay, tell me the function of, tell me the effects of HDL, LDL, cholesterol, triglycerides effects.
LDL કોલેસ્ટ્રોલ ને ઇન્ક્રીઝ થાય તો કોરોનરી આર્ટરી ડિસીઝ નું રિસ્ક રહે અને જો HDL ઇન્ક્રીઝ થાય તો it is a good thing.
Yes, it is good thing. It prevents the artery from getting clogged, or it prevents from coronary artery disease. What about triglyceride? If triglyceride increases, then
Fat increase થશે.
yes, there is another again risk of coronary artery disease. It's also not a good kind of a cholesterol that it increases. Then it is helpful for our body. Does fasting required for this test?
Yes.
Yes. Yes, the fasting is required. The client is only allowed to consume water before 12 to 14 hours. What about meals and what advice you will give to the patient? Yes.
Not
What
to
about
take alcohol before 24 hours.
yes, we will advise the patient not to take alcohol before 24 hours. Then what about food?
Evening meal માં food fat food avoid કરવાનું.
Yes, we will advise the client to avoid the fatty food in the evening meal, not to take so much of fatty food, fried food, or oily food. Okay. What is the normal value for all the lipids? Yes. Okay. Online students.
Cholesterol less than 200 mg per dl.
Yes.
LDL less than 100 mg per dl.
Okay.
અને HDL greater than 60 mg per dl.
Okay. What about triglyceride?
Male 40 to 160
Yes.
and female 35 to 135.
35 to 135. Yes, absolutely correct. Then we have seen in which conditions the cholesterol and LDL becomes elevated, and in which conditions the triglyceride becomes elevated, in which conditions the cholesterol, LDL, and triglycerides becomes decreased. Okay. Next is fasting blood glucose. What is that? To determine whether the client is suffering from diabetes mellitus or hypoglycemia. To check the level of glucose in the blood is called as fasting blood glucose. What is the normal range of FBS?
70 to 99 mg per dl.
Yes, the fasting blood sugar's normal range is 70 to 99 mg per dl. Does fasting require or not?
Yes, required.
Yes,
Yes, it is
required.
required because its name only suggests fasting blood glucose. What advice you will give to the patient?
Fast for 8 to 12 hours before.
Yes, we will advise the patient to not consume any food before 8 to 12 hours of taste. Then another advice?
ઇન્સ્યુલિન અને જે OHS મેડિકેશન એ હોલ્ડ કરવાની.
Yes, we will advise the patient to not to take the medications like insulin and OHA in the morning. The patient can consume the food and medications after the test is done. Okay, then in which conditions the fasting blood glucose elevates and in which conditions the fasting blood glucose decreases, that we have seen. Next, we have seen glycosylated hemoglobin, that is HbA1c. What is that?
Past 3 to 4 months માં ગ્લુકોઝની એવરેજ ચેક કરવા માટે.
Yes, this test is used to check the average blood glucose level for past 3 to 4 months. At what range the client is maintaining their blood glucose level. What is the normal reference interval?
Less than 5.7 to 5.7 to
Less.
6.4. Less than.
Okay, there are normally three intervals. Tell me about all three intervals. Okay. Okay, online students.
Less than 5.7%, it's normal. Between 5.7 to 6.4%, it's pre-diabetic. And
Okay.
more than 6.4%, it's diabetic.
Diabetes, yes. So you have to remember this, all the intervals, normal reference intervals, you have to remember this. In which conditions HbA1c becomes elevated, in which conditions HbA1c reduces, that we have seen. Then we have studied about renal functions blood test. In renal function test, we have studied two types of lab values. Which were that? Yes, there is serum creatinine and BUN. What is serum creatinine? Yes, if the creatinine is high, then what does it indicate?
Renal
Yes.
failure.
Yes, the kidney is not functioning properly. The renal function has impaired. If the creatinine is slightly elevated or increased than normal range, then what does it indicate? The glomerular function has reduced, and later on it will completely damage. It will get completely damaged. So what is the normal range of serum creatinine? Yes. One point one. Online students.
Average 0.5 to 1.2 mg per day.
Okay. The combinedly we can say 0.5 to 1.2 for male and female combined. Does fasting is required for or not?
No.
No required.
No, there is no requirement of fasting. But what advice you will give to the patient?
Excessive exercise avoid करवाने before 8 hours.
Yes, and another thing.
Red meat meals avoid करवाना before 24 hours.
Yes, we have to advise the patient not to do excessive exercise. Patient can do normal exercise, but not a vigorous exercise before 8 hours, and avoid red meat food before 24 hours. In which conditions the serum creatinine gets elevated, and in which conditions the serum creatinine gets decreased, that we have seen. Next was BUN. What is that? Yes. Okay. Online students, what is BUN?
One type of waste product.
Yes, it is a one type of waste product. It is a blood test through which we can identify how much waste product is there in the blood. Does it only recognize the renal function?
No.
No, it is not directly dependent on the renal function. There are much more reasons due to which the BUN can get elevated. So it does not rely only on the renal function. What is the normal range of BUN?
10 to 20 mg per day.
Yes, 10 to 20 mg per dl. In which conditions the BUN gets elevated, and in which conditions the BUN becomes decreased, that we have seen. And last was WBC. What is that? WBCs are defense mechanism of our body. It helps to fight the infection. What concepts we have completed in WBC? Okay, online students.
Shift to
What?
left, shift to right, and normal in ref range.
Yes, what is shift to left, shift to right?
High
Shift to
number
left,
immature WBC.
In shift to right?
shift to left.
Okay. Shift to left means increased number of immature WBCs. What with the normal WBCs?
5,000 to 10,000.
Yes, but if shift to left increases, what happens with TLC?
ડિક્રીઝ થશે.
Decrease. It means there is no mature RBCs. Yes. And what is shift to right?
મેચ્યોર ડબ્લ્યુબીસી ઇન્ક્રીઝ થશે અને ઇમેચ્યોર ડિક્રીઝ થશે.
Yes, there is no any immature WBCs. It won't decrease or anything, but there are only mature WBCs which get increases. What happens with the TLC?
ઇન્ક્રીઝ.
It also increases. Yes. Then in which conditions the WBCs become high, in which conditions the WBC becomes low. That we have seen. The red important point that you have to remember is yes. If neutrophil increases, then so what is that called as? Online students, what is the rate point?
ડ્યુરિંગ કીમોથેરાપી ન્યુટ્રોપેનિક પ્રિકોશન્સ લેવાના.
Yes, if the patient is receiving chemotherapy, we have to closely monitor WBC, whole WBC count and differential count. Both we have to monitor closely, and there is a risk of infection due to the neutropenia because of chemotherapy. So remember this point. Okay, any doubt in this chapter?
નો મેમ.
Okay, so let's start new chapter. Okay, so let's start chapter 11, that is nutrition. The priority concept for this chapter is health promotion and nutrition. We have to promote the health of a patient. We have to decrease the illness, or we have to promote the health by providing a nutritious diet. And the next is nutrition itself. Both are priority concept for this chapter. Okay, so let's study about the nutrients. Tell me how many nutrients are there? Okay, mainly there are two types of nutrients. Macronutrients and micronutrients. Tell me about macro and micro. Online students. What is macro and micro? What are macronutrients? You have already studied this in first year nutrition subject. First year માં જ આવતો હતો. Any idea? Random guesses you want to do?
Carbohydrate, protein, and fat.
Yes, there are three macronutrients. Carbohydrate, protein, and fats. And what about micronutrients?
વિટામિન્સ.
Yes. Vitamins?
Electrolyte.
No. Okay, yes, we can say it.
મિનરલ અને
Electrolyte. Yes. Minerals are itself electrolytes. Okay. What about vitamins? Vitamins again divided into two categories. Yes, it is water soluble and fat soluble. What are water soluble vitamins and what are fat soluble? Which are
ફેટ ADEK.
A, D, E, K. What about water soluble?
B and C.
Yes, B and C. All vitamin B complex, vitamin B 1, 2, 3, 5, 6, 7, then 9, 12. All vitamin B is water soluble and vitamin C. So this is the basic concept of nutrients. All we will study that. What about macronutrients? About macronutrients, we will study in this chapter. Okay. Now let's start the nutrients. The first is carbohydrate, which is a macronutrient. Carbohydrates are the preferred source of energy. Yes, our body utilizes carbohydrates for the energy. It is a preferred source for energy. Each gram of carbohydrate produces 4 kilocalories per gram. What does this mean? If one person is consuming only 1 gram of carbohydrate, 1 gram of carbohydrate can produce 4 kilocalories per gram. That is the energy. So the amount of carbohydrate the patient consumes, the amount of energy the patient will get. Carbohydrates promotes normal fat metabolism. Inadequate carbohydrate intake affects the metabolism. If the person is taking normal carbohydrate, person अच्छे से carbohydrate consume कर रहा है, then उसकी वजह से जो fat metabolism है वो normalize होगा. If the person is not consuming enough carbohydrate, then what will happen? Yes, if there is no carbohydrate for the source of energy, body will break down what? If there is no carbohydrate, then okay, there is the thing, but body will require energy. So energy के लिए तो कुछ भी करेगी तो सही ना body. So what will the body do? Carbohydrate is not there. Second, what get metabolized? Yes, someone is trying to speak. Yes, please.
Fat no metabolism.
Yes, there is a first the body will always break down the carbohydrate to get the energy. If there is no carbohydrate in the body, there is no sufficient carbohydrate, the body will metabolize the fat and will get the energy from metabolism breakdown of the fat. And if there is no fat, then the body will break down
Protein.
Muscles.
protein. Yes, to get the energy. Yes. So the carbohydrate protects the fat metabolism. It won't affect the fat of the body if there is enough carbohydrate. If there is not enough carbohydrate, the metabolism will get affected and the fat breakdown will initiate it. Understood?
Yes.
Yes.
તમે હમણાં પ્રોટીનનું બોલ્યા ને ત્યારે તમારો અવાજ થોડો કટ થઈ ગયો. શું બોલ્યા તમે એ ટાઈમે
Okay.
પ્રોટીન માટે?
Yes. So body ma always first of all carbohydrate breakdown થાય to get the energy. If there is no enough carbohydrate for the body to get the energy, body જાતે જ fat breakdown કરવાનું start કરી દેશે to get the energy. And fat પણ નહીં હોય બોડીમાં તો પછી બોડી પ્રોટીનનું બ્રેકડાઉન ચાલુ કરી દે. મસલ વેસ્ટિંગ થઈ જાય છે ને બધા પેશન્ટ્સમાં, so એ પ્રોટીન બ્રેકડાઉન ચાલુ કરી દે to get the energy. આનું એક બેસ્ટ એક્ઝામ્પલ છે. which condition is this? જે કન્ડિશનમાં કાર્બોહાઈડ્રેટ હોય છે તે છતાં પણ સેલ્સ યુટિલાઇઝ નથી કરી શકતા ફોર ધ એનર્જી અને પછી એ બીજી વસ્તુ બ્રેકડાઉન કરે છે. In which condition this happen? बॉडी में इनफ देयर इज वन कंडीशन जिसमें बॉडी में इनफ कार्बोहाइड्रेट है पर सेल्स यूटिलाइज नहीं कर पा रहे वो कार्बोहाइड्रेट और एनर्जी के लिए वो फैट मेटाबॉलिज्म स्टार्ट कर देते हैं. What is that condition? આવું ના ચાલે. આપણે સ્ટડી કર્યું છે. You have to think like this. decay માં શું થાય? What is the pathophysiology for decay? There is enough of glucose, but because of lack of insulin, the glucose is not used by the cells. And cells will break down the fat to get the energy. And due to the breakdown of the fat, there is a waste product produced inside the body, due to which the acidosis occurs. હવે યાદ આવ્યું કશું? Yes or no? Am I audible to you?
Yes.
Yes.
Yes. So કશું યાદ ડીકે નું? પતી ગયો ચેપ્ટર. હવે યાદ રાખીને શું કરવાનું? એન્ડોક્રાઇન ચેપ્ટર પતી ગયો. Please make your concepts clear. Okay, let's move on to next. Carbohydrate serves as the main source of fuel, that is the energy, providing glucose for the brain and for the skeletal muscles during exercise. Carbohydrate also promotes erythrocytes and leukocyte production and cell function. Carbohydrate is the main source of fuel for our body. It provides glucose for the brain, normal brain function, for the normal skeletal muscle function during exercise, and carbohydrate also promotes erythrocytes and leukocyte production, that is RBCs and WBCs, because bone marrow will require energy for the production of RBCs and WBCs. From where did the bone marrow get the energy? Only from the glucose, that is the carbohydrate. Then carbohydrate also promotes the cell function. Major food sources of carbohydrates includes milk, grain, fruits, and vegetables. From where does a person gets the carbohydrate? From milk, from grains, from fruits, and from vegetables. All these are sources of carbohydrates. Next macronutrients is fat. Fat provides a concentrated source and a stored form of energy. Fat is a stored form of energy. When there is no carbohydrate, fat will be utilized. So it is a stored form of energy. Fat protects the internal organ and maintain the body temperature. Fat covers all the organs and it maintains the body temperature. For example, कोई person है जिसकी body में fat कम है, so वो पर्सन है वो कोल्ड सेंसिटिव हो जाएगा, उसको ठंडी ज्यादा लगेगी, बिकॉज देर इज नॉट इनफ ऑफ फैट इन द बॉडी. एंड कोई पर्सन है जिसमें फैट ज्यादा हो तो उसको इंसुलेशन, फैट इंसुलेशन प्रोवाइड करता है, तो उसको ठंडी कम लगेगी. फैट एनहांस द एब्जॉर्प्शन ऑफ फैट सॉल्युबल विटामिन्स. अगर फैट्स ही नहीं होगे तो जो फैट सॉल्युबल विटामिन्स है उसका एब्जॉर्प्शन कैसे होगा? So fat is required for the absorption of fat soluble vitamins. It enhances their absorption. Fat provides 9 kilocalorie per gram. How much energy a 1 gram fat can provide? So it provides 9 kilocalorie per gram of energy. Okay. Inadequate intake of essential fatty acid leads to clinical manifestations of sensitivity to cold, skin lesions, increased risk of infection, and amenorrhea in the womb. अगर कोई पर्सन है जिसका फैटी एसेंशियल एसिड कंजप्शन कम है, जैसे कि हमने देखा था कि लिपिड्स की नॉर्मल रेंज मेंटेन होनी चाहिए, अगर कम हो जाएगी तो प्रॉब्लम्स होगी. तो अगर कोई पर्सन है जिसका फैटी एसिड का कंजप्शन, फैटी एसिड कहाँ से आएगा? ब्रेक डाउन ऑफ द फैट प्रोवाइड्स फैटी एसिड. अगर कोई पर्सन एसेंशियल फैटी एसिड नहीं कंज्यूम कर रहा है, सो उसकी वजह से क्या क्या देखने को मिलेगा? वो सेंसिटिविटी टू कोल्ड देखने को मिलेगा, बिकॉज उसका पर्सन की बॉडी में फैट है ही नहीं फॉर द इंसुलेशन. स्किन लीजन्स बढ़ जाएंगे, स्किन ड्राइनेस हो जाती है ना, बिकॉज ऑफ डिक्रीज फैटी एसिड. Increased risk of infection. We know fat lipids are useful for healing of the cells. So increased risk of infections हो जाएंगी और फीमेल्स में एमेनोरिया देखने को मिलेगा. What is एमेनोरिया?
Absence of menstruation.
Yes, absence of menstruation. तो अगर कोई फीमेल बहुत ही डिक्रीज लेवल ऑफ फैट्स है और फैटी एसिड्स बहुत कम है, तो ये सारे साइंस दिखने को मिलेंगे. Diets high in fat can lead to obesity and increased risk of cardiovascular disease and some cancers. फैट अगर कम हो तो भी प्रॉब्लम, ज्यादा हो जाएगा तो भी प्रॉब्लम है. इट शुड बी ऑलवेज मेंटेन इन द नॉर्मल रेंज. अगर फैट डाइट कंज्यूम ज्यादा कर लेगा कोई पर्सन तो उससे ओबेसिटी का रिस्क हो जाएगा, इंक्रीज रिस्क ऑफ कार्डियोवैस्कुलर डिजीज, ज्यादा फैट की वजह से कार्डियोवैस्कुलर डिजीजेस हो गए और सम काइंड ऑफ कैंसर्स भी हो सकता है कोई पर्सन को. Next macronutrient is protein. Amino acids which make up proteins are critical to all aspects of growth and development of the body tissue and provide 4 kilocalorie per gram. Protein is very essential for the growth and development because प्रोटीन्स में से एसेंशियल अमीनो एसिड्स मिलते हैं और उसकी वजह से जो मसल बिल्डअप होना चाहिए, जो नॉर्मल ग्रोथ एंड डेवलपमेंट होना चाहिए, वो बहुत ही इंपॉर्टेंट है एंड इट इज ओनली डन विद द हेल्प ऑफ प्रोटीन. और 1 ग्राम प्रोटीन से कितनी एनर्जी मिलती है? सो 4 किलो कैलोरीज पर ग्राम. Protein build up and repair body tissues, regulate fluid balance, maintain acid-base balance, and produces antibodies, provides energy, and produces enzymes and hormones. Protein का function क्या है? So वो build भी करते हैं body को और repair भी करते हैं body tissues को. It regulates the fluid balance भी regulate करने में help करता है. Acid base balance भी regulation में proteins indirectly help करते हैं. एंटीबॉडीज भी प्रोड्यूस करते हैं बिकॉज वी नो ऑल एंटीबॉडीज आर प्रोटीन डेरिवेटिव्स, वो प्रोटीन से ही बनती है. प्रोवाइड्स एनर्जी एंड प्रोड्यूसेस एंजाइम्स एंड हार्मोन्स, वो एंजाइम्स भी प्रोडक्शन में हेल्पफुल करती है और एंजाइम हार्मोनल प्रोडक्शन में भी हेल्पफुल है. एसेंशियल अमीनो एसिड्स आर रिक्वायर्ड इन डाइट बिकॉज बॉडी कैन नॉट मैन्युफैक्चर देम. हमें प्रोटीन बाहर से ही देना होगा, हमारी बॉडी खुद से प्रोड्यूस नहीं कर सकती ऑल द एसेंशियल अमीनो एसिड्स. सो वी हैव टू गिव अवर बॉडी द ऑल एसेंशियल अमीनो एसिड्स फ्रॉम आउटसाइड by consuming them. The body cannot manufacture them. Complete proteins contains all essential amino acids. Incomplete protein lack of some of the essential fatty acids and amino acids. What is the there are two types of protein, complete protein and incomplete protein. Complete protein means all types of essential amino acids are present in that food, so it is called as complete protein source. And incomplete protein means there are lack of some kind of amino acids and fatty acids in that, so it is incomplete protein. Inadequate protein can cause protein energy malnutrition and severe wasting of the fat एंड मसल टिश्यू. अगर कोई पर्सन प्रोटीन प्रॉपरली कंज्यूम नहीं कर रहा है, प्रॉपरली प्रोटीन इंटेक नहीं है, तो उसकी वजह से प्रोटीन एनर्जी माल न्यूट्रिशन हो सकता है. पीईएम वाला चाइल्ड आपने देखा है इन इमेजेस, आपने पहले स्टडी किया होगा इन न्यूट्रिशन और इन बायोलॉजी. पीईएम वाला चाइल्ड देखा है ऑनलाइन स्टूडेंट्स फोटोग्राफ में? दिस इज द पीईएम, प्रोटीन एनर्जी माल न्यूट्रिशन. ऐसा यस और नो? हाँ. सो उसका पीएम वाला चाइल्ड कैसा होगा? सारे मसल्स वेस्टिंग हो जाएंगे, एकदम थीन लगेगा वो. सो inadequate intake of protein can cause protein energy malnutrition and severe wasting of fat and muscle tissue. बॉडी में से बॉडी में मसल्स हो गए ही नहीं, मसल बिल्डअप होगा ही नहीं. सीवियर वेस्टिंग ऑफ फैट एंड मसल्स, वो पर्सन बहुत ही थीन लगेगा. द इम्पोर्टेंट पॉइंट दैट यू हैव टू रिमेम्बर इज major stages of lifespan with specific nutritional needs are pregnancy, lactation, infancy, childhood, and adolescence. Adults and older adults may experience physiological changes related to aging that will influence the individual nutritional needs. What does this point is suggesting us? कि जो पूरी भी लाइफ स्पान है उसमें से कौन से स्टेजेस में न्यूट्रिशनल नीड ज्यादा होती है और बहुत ही स्पेसिफिक होती है. ड्यूरिंग प्रेगनेंसी द न्यूट्रिशनल नीड मस्ट बी मेंटेन. ड्यूरिंग लैक्टेशन, ड्यूरिंग इन्फेंसी, ड्यूरिंग चाइल्डहुड एंड ड्यूरिंग एडोलेसेंस. These are the stages in which we have to maintain a specific nutritional need. We cannot compromise with the nutritional needs during these stages. But adults and older adults may experience physiological changes due to their aging. So the need will be depending on the individual person. For example, there are two adults. One adult will require different type of nutrition. One adult will require different type of nutrition. So for adult and older adult, the nutritional need is individualized. It is not a specific. But during pregnancy, during lactation, during infancy, during childhood, and during adolescence, all the nutritional needs must be met by the patient. Okay, understood this point?
મેમ
Yes.
મને આ કમ્પ્લીટ અને ઇનકમ્પ્લીટ પ્રોટીન વાળું થોડું ખબર ના પડી જરા.
Yes. So there are mainly two types of protein, complete protein and incomplete protein. Complete protein means, for example, we can say the non-vegetarian food જે પણ હોય છે એ complete source of protein કહેવાય, because એની અંદર બધા જ essential amino acids આવી જાય છે. અને ઇનકમ્પ્લીટ પ્રોટીન એટલે બધા જ એસેન્શિયલ અમીનો એસિડ્સ નથી આવતા, એની સાથે સાથે તમારે બીજું લેવું પડે. ફોર એક્ઝામ્પલ, હું તમને એક એક્ઝામ્પલ આપું છું. નોન વેજીટેરિયનમાં ચિકન તમે કંઈક એક્ઝામ્પલ લઈ લો તો એમાં બધા જ એસેન્શિયલ અમીનો એસિડ આવી જશે. એ કમ્પ્લીટ સોર્સ ઓફ પ્રોટીન છે, એમાં બધું જ મળી ગયું. બટ ઇફ અ પર્સન ઇઝ વેજીટેરિયન, એ નોનવેજ નથી ખાતું, સો ડેલી તમારે બધા જ એસેન્શિયલ અમીનો એસિડ્સ તો કન્ઝ્યુમ કરવા જ પડશે. સો ફોર એક્ઝામ્પલ, દાલ અને રાઈસ ખાઈએ આપણે, તો દાલની અંદર એક અમીનો એસિડ ઓછું હોય જે રાઈસમાંથી મળી જાય. ફોર એક્ઝામ્પલ, દાલની અંદર બધા જ એસેન્શિયલ અમીનો એસિડ્સ હોય એક્સેપ્ટ ફોર લાઇસિન. લાઇસિન નથી હોતું. તો એ પર્સન દાલ ને રાઈસ કમ્બાઈન કરીને ખાય તો રાઈસની અંદર લાઇસિન હોય છે, તો રાઈસમાંથી લાઇસિન મળી જાય. સો કમ્બાઇનલી એ કમ્પ્લીટ પ્રોટીન કહેવાય, પણ ઓનલી દાલ ઇઝ નોટ કમ્પ્લીટ પ્રોટીન.
Okay.
Understood?
Yes, ma'am. Thank you.
Yeah. Okay. Then next is micronutrients. In that, the first is vitamins. So let's see the box 11.1, sources of vitamins. So the vitamins are categorized into two forms: water soluble vitamins and fat soluble vitamins. Water soluble vitamins are folic acid or folate, which is also called as vitamin B9. From where does we get the folic acid or folate? From green leafy vegetables, liver of human beings. So animal, yes, from chicken or from we can say the mutton or the liver of animals. So from that we can get folic acid. Beef, fish, legumes, grapefruit and oranges. These are the sources of folic acid. Next is niacin. Niacin is a vitamin B3, I guess. Yes, it is vitamin B3. Niacin is vitamin B3. From where do we get niacin? From meat, poultry, fish, beans, peanuts and grains. These are the sources of niacin. Next is vitamin B1. That is the thiamine. From where do we get vitamin B1? So from pork, nuts, whole grain, cereals and legumes. So these are the sources of vitamin B1, that is the thiamine. Vitamin B2, from where do we get the vitamin B2? That is the riboflavin. So from milk, lean meat, fish and grains. These are the sources of vitamin B2, riboflavin. From where do we get vitamin B6? That is the pyridoxine. From yeast, corn, meat, poultry, fish. These are the sources of vitamin B6. Vitamin B12, which is also called as cobalamin. From where do we get vitamin B12? Majorly, it is obtained from the animal source, that is meat and liver of the animals. Vitamin C. Only vitamin B, all the vitamin B and vitamin C are the water soluble vitamins. So vitamin C is also called as ascorbic acid. From where do we get vitamin C? From all the citrus fruits, tomatoes, broccoli, cabbage, all are the sources of vitamin C. These are the water soluble vitamins. Next is fat soluble vitamins, that are A, B, E and K. From where do we get vitamin A? From dairy products, fish, liver, green or orange vegetables and fruits. These are the sources of vitamin A. From where does we get vitamin D? So it is fortified milk, fish oils and most cereals. From all these things we can get vitamin D. Vitamin E is obtained from vegetable oils and products made with vegetable oils. For example, margarine and salad dressing, fruits, vegetables, grains, nuts like almonds and hazelnuts, seeds like sunflower seeds, and fortified cereals. All these are sources of vitamin E. Vitamin K. From where does we get vitamin K? So from green leafy vegetables and cruciferous vegetables. What is cruciferous? Cruciferous vegetables means?
જે કોલીફ્લાવર ને કોબીસ આવે ને
Yes, cauliflower, cabbage, broccoli, all these are family of cruciferous vegetables. I don't know કે ગુજરાતીમાં એને શું કહેવાય, પણ એવા જે બધા वो सारे जो vegetables होते हैं वो cruciferous family में आते हैं. So all the cruciferous vegetables such as turnip greens. What is turnip greens? If I'm saying radish green, so what is that? Radish green. Radish greens means what is radish? Radish means yes, the આપણે જે ગુજરાતીમાં કહીએ છીએ મૂળો એ. તો રેડિશ ગ્રીન્સ એટલે
એની જે ભાજી આવે
yes, leaves of the radish. So turnip greens, turnip બી મૂળા જેવું જ દેખાય. It is like આવા શેપનું હોય છે turnip, અને એની ઉપર પણ આવી રીતે ભાજી હોય છે. So turnip greens હોય છે, એમાંથી પણ વિટામિન કે મળે છે. જેટલા પણ ડાર્ક ગ્રીન લીફી વેજીટેબલ્સ હોય, these are the source of vitamin K. So it is obtained from green leafy and cruciferous vegetables such as turnip greens, spinach, cauliflower, cabbage, and broccoli, and certain vegetable oils including soybean oil, cottonseed oil, canola oil, and olive oil. These are the sources of vitamin K. You have to remember all these sources. इन दिस चैप्टर हम जो भी पढ़ेंगे, वाटर सॉल्युबल विटामिन के सोर्सेस, फैट सॉल्युबल विटामिन के सोर्सेस, कार्बोहाइड्रेट, फैट, प्रोटीन के सोर्सेस, सोडियम, पोटेशियम, कैल्शियम के सोर्सेस, आपको सारे सोर्सेस याद रखने हैं. बिकॉज इन एग्जामिनेशन यू विल बी आस्क लाइक दिस कि पेशेंट को फॉर एग्जांपल XYZ कंडीशन है, वी कैन से कि पेशेंट को किडनी फेलियर है, एक्सेसिव किडनी फेलियर. सो वी नो कि उस पेशेंट को हम प्रोटीन नहीं दे सकते, सोडियम नहीं दे सकते और पोटेशियम नहीं दे सकते. सो आपको ऑप्शंस दिए होंगे, आपको सिर्फ उतना ही बताए कि पेशेंट को क्रोनिक किडनी डिजीज है, विच टाइप ऑफ फूड you will avoid in the patient. So we have to understand कि we have to avoid protein rich food, sodium rich food, and potassium rich food. So you have to read all the options and you have to find out that this source is rich in protein, this source is rich in sodium, this source is rich in potassium, and then you have to select the option. Understood my point?
Yes, ma'am.
Yes. So you have to remember the sources of all the vitamins, all the nutrients, macro and micro. I understand this is a bit difficult, but you have to still remember this. The sources you have to always remember this because you will be asked in such a manner. So try to remember all these sources. Okay, next, okay, let's start. Vitamins facilitate the metabolism of protein, fats, and carbohydrates and act as a catalyst for metabolic function. विटामिन की वजह से जो फैट का, प्रोटीन का और कार्बोहाइड्रेट का प्रॉपर जो मेटाबॉलिज्म होना चाहिए वो होता है. इट एक्ट्स एज अ कैटालिस्ट. व्हाट इज द कैटालिस्ट? कैटालिस्ट मीन्स, कैटालिस्ट मीन्स
जो प्रोसेस को फास्ट करता है वो.
yes, catalyst boosts the process of metabolism of or anything. So it is a catalyst for metabolic function. जो भी metabolism करने के लिए जो energy चाहिए, vitamins as a catalyst work करता है, वो boost करेगा metabolism को. Vitamins promote life and growth processes and maintains and regulates the function. Vitamins का function क्या है? It promote the life and growth process. It maintains and regulates the body functions. Fat soluble vitamins are A, D, E, and K and can be stored in the body. So an excess can cause the toxicity. Fat is stored in the body. We know that fat is stored in our body. So whichever the vitamins are fat soluble vitamins can be stored in the body. So if a person consumes more vitamin A, more vitamin D, more vitamin E, or more vitamin K, the body can experience toxicity of that vitamin. So it is not like that कि vitamins अच्छे हैं तो हम ज्यादा consume करेंगे तो वो beneficial होगा. No, the fat soluble vitamins are stored inside the body, so excess can lead to toxicity. And vitamin B and vitamin C are water soluble vitamins. so are not stored in the body and can be excreted in the urine. अगर कोई विटामिन बी एंड सी है वो वाटर सॉल्युबल विटामिन है और हमारी बॉडी में वाटर स्टोर नहीं होता, वो डेली बेसिस पे यूरिन थ्रू एक्सक्रीट होता है. तो जितने भी विटामिन सी रिच फूड है और बी रिच फूड है हमने खाए हैं, सो इट डजंट मीन कि आपका विटामिन सी इंटेक आज आपने ब्लड टेस्ट करवाया और आपका विटामिन बी 12 आज अच्छा है, so it will always stay like that. It is not like that. It will always get eliminated from the body because it does not store in our body. So we have to consume it daily. Vitamin B and vitamin C, we have to consume it daily. It cannot be stored in our body. Understood?
Yes, ma'am.
Yes. Next is minerals and electrolytes. So let's see box 11.2. All types of minerals. You have to remember the sources of that minerals. That is the important concept of this chapter. So let's see the first mineral, that is the calcium. From where do we get the calcium? From dairy products like milk, cheese, yogurt, from tofu, from green leafy vegetables like broccoli, collard, kale, mustard, mustard greens, turnip greens, and bok choy. These are the examples. I can understand that foods are something new for you, but you have to just Google it and try to remember it. Because in examination, the food you will get in the option is not your known food. It will be something new for you because this food we do not consume in our country, but it is consumed by the persons who are living in the NCLEX countries. So there will be always a new kind of food. So try to remember as much as you can remember. So you have to remember all these types of food. Salmon and sardines, almonds, Brazil nut, sunflower seeds, tahini, and dried beans, and blackstrap molasses. These are the examples of calcium-rich food. These are the sources through which a person can get the calcium. Okay. Next is chloride. From where do we get chloride? So only from the salt, because salt is made up of sodium and chloride. So chlorine we can get from the salt. Next is iron. Iron is obtained from dried beans, dried fruits, egg yolk, iron fortified cereals, liver, meat, especially lean and red meat or poultry meat, oysters, salmon, tuna, and whole grains. These are the sources of iron. Next is magnesium sources. From where does a person get magnesium? So dark green leafy vegetables, fruits such as banana, dried apricot, and avocados, nuts such as almonds and cashews, peas and beans like legumes, seeds, soy products such as soy flour and tofu, whole grains such as brown rice, millet, and milk. These are the sources of magnesium. जो भी आपको फूड नहीं पता चल रहा है, you can Google it because I can understand there are much more new things. Let's do one thing. What is collard? કોઈને ખબર છે? Does anyone know? In calcium, there is collard word, kale, collard. Okay, let's do one thing. Google it right now. Collard. Everyone, please search collard. Have you searched it? Got it? What is called as collard? Then kale. Okay. So I'm saying you one thing that you have to Google it. You have to see how that looks and you have to remember that this is the rich source of calcium. Simply you have to remember these things. Okay, can we move to next or we do you want to see all the pictures of new food items? क्या करूं मैं आगे कंटिन्यू करूं कि आपको अभी एक एक देखना है जो भी न्यू फूड आइटम्स है वो?
Continue, ma'am.
Okay, so I'm continue. So let's start with the phosphorus-rich food. That the phosphorus is obtained from the seeds like sunflower seeds, pumpkin seeds, and squash seeds. Whey is the what is whey? It is a protein, whey protein. Yes, so it is rich in phosphorus as well. Then cheese, cornmeal, beans, nuts, salt-free nuts like almond and peanuts, but it should be salt-free. Then potassium, the rich source of potassium is all meats, that is red meat and chicken, and fish, that is salmon fish, cod fish, flounder, and sardines. These are the types of fishes. Soy products and veggie burgers, vegetables like broccoli, peas, lima beans, tomatoes, potatoes, particularly their skin. They are rich source of potassium. Not, we can say not rich source, but through that we can obtain the potassium. Sweet potatoes and winter squash, fruits like citrus, cantaloupe, banana, kiwi, prunes, and dried apricot, milk and yogurt and nuts. These are the sources of potassium. Next is sodium. So from where does a person get sodium? So sodium chloride, that is the table salt, normal salt. Milk, beets, celery, some drinking waters, food products, that is Worcestershire sauce, soy sauce, onion salt, garlic salt, and bouillon cubes, processed meats like bacon, sausages, and ham, canned soup, and canned vegetables. All canned products are rich in sodium. Just remember this point. Processed and baked foods, fast foods, all canned products, all preserved products, and all processed foods are rich in sodium. We have to avoid these foods in cardiac patient, in renal patient, and in hypertensive patient. Zinc is obtained from animal proteins like beef, pork, and lamb, nuts, whole grain, legumes, and yeast. These are the sources of zinc. In examination, try to remember the important electrolytes, that is calcium, iron, potassium, sodium. These are the important electrolytes. This question, from this the questions are asked more, like rich source of iron, because the pregnant women or the adolescent girl will need the iron. Then about calcium, potassium, and sodium. So you have to anyhow remember this. Anyhow, you have to remember this. Okay. So minerals are components of hormones, cells, and tissues and the bones. Minerals कहाँ के components है? वो hormones में भी present होते हैं, cells में भी होते हैं, tissues में भी होते हैं, और bones में भी minerals देखने को मिलते हैं. Minerals act as a catalyst for chemical reaction and enhancer of the cell function. Minerals कैसे work करते हैं? तो जो भी chemical reactions हमारी body में होता है, उसमें catalyst की जैसा रोल प्ले करते हैं और वो सेल का फंक्शन एनहांस करते हैं सारे मिनरल्स. Almost all food contains some form of minerals. We have seen that some foods are common for all types of minerals. So almost all food contains some amount of minerals. A deficiency of mineral can develop in chronically ill or hospitalized client. जब भी कोई पेशेंट बहुत ही ज्यादा बीमार हो, क्रोनिकली इल हो और वो हॉस्पिटलाइज हो, तो उसमें मिनरल्स की डेफिशिएंसी देखने को मिलती है, इलेक्ट्रोलाइट इम्बैलेंस हो जाता है उसमें. So it can be seen in chronically ill or hospitalized client. Electrolytes plays a major role in osmolality and body water regulation, acid-base balance, enzyme reaction, and neuromuscular activity that we have already completed in chapter 8 about fluid and electrolytes. So electrolytes का major function क्या है? वो osmolality of body and water का maintain करते हैं, concentration maintain करते हैं, acid base balance में helpful है, enzyme reactions में भी helpful है, और neuromuscular activity में भी बहुत important है electrolytes. Next component, that is not nutrient but the major component of the body, that is the water. It is critical for the cell function. If there is no water, the cell will be shrinked or cell can die. So it is the critical for cell function, makes up 60 to 70% of the total body weight. A person's total body weight, from that water contains 60 to 70% of that weight. A person cannot survive without water for more than few days. No one can survive without water. Only they can survive for few days. Hardly we can say 2 or 3 days, not more than that. The person will die without water. So water is important part of the body. Okay, let's take some short break and then we will continue with the malnutrition laboratory markers. Online students, please come back from break. Excuse me. ના હું પીતી નથી પણ આ દરવાજો ખુલ્લો છે. Online students,
Yes,
please
ma'am.
come back. Yes, should we start now?
Yes.
Okay. So let's start with the malnutrition. What does the heading suggest to you?
ન્યુટ્રિશન ઓછું હોય.
But laboratory markers means you can identify through the lab test about the malnutrition status. What is the status of a person through some kind of laboratory test. These are called as markers. For example, just cardiac markers, liver function markers, renal function markers. So these are the some tests through which you can identify about the malnutrition or the nutritional status of a person. So first is hematological studies, that is blood studies. So complete blood cell count with RBC cell indices and peripheral smear. Through a complete CBC count and through the RBC's indices. What is the RBC's indices? The different indexes of RBCs. If you have ever seen a blood report, just a minute. Okay. What are the indexes of RBCs? If you have ever seen, you have find out that MCV, MCH, then MC, VH. Have you ever seen this in blood report? आपने कभी ऐसा देखा है ब्लड रिपोर्ट में? सीबीसी में कंप्लीट ब्लड काउंट में सब होता है. HB, hematocrit, then platelet, WBC, differential kind of WBCs, then RBCs में MCV, MCH, ये सब देखा है आपने?
હા.
Yes or no?
Yes.
So yes, this gives you the complete idea about the nutritional status. MCV, that is mean corpuscular volume, then MCH, that is mean corpuscular hemoglobin. In that you will find that macrocytes, microcytes, then what is another word? Hypochromic, hyperchromic, normochromic. These are the words. Through that you can identify the status of HB and hematocrit and all the things. These studies differentiate between the anemia and nutritional deficiencies. Through this, we can identify the patient is suffering from which deficiency, vitamin B12 anemia, iron deficiency anemia, which type of anemia the patient is experiencing. So through this CBC test, through the RBC's indexes, we can find out the type of anemia. These are the laboratory markers through which we can study about the anemia, difference between the anemia. Understood my point? पता चला मैं क्या बोल रही हूँ? Yes or no? Online students? जब भी हम ब्लड टेस्ट करते हैं सीबीसी के अंदर सारी इंफॉर्मेशन होती है. व्हाट आर द नॉर्मल हीमोग्लोबिन, हेमाटोक्रिट, देन आरबीसी भी नॉर्मल वैल्यू होती है और आरबीसी के अंदर उसके इंडेक्सेस, दैट आर द टाइप्स ऑफ आरबीसीज की what is MCH level, what is MCV level, what are these levels, Then WBC count, types of WBCs, that is differential white blood cell count. So all this present in the CBC, complete blood cell count. Through this test, we can identify the type of anemia. If it is microcytic, the MCV is microcytic, then we can identify the patient is experiencing iron deficiency anemia. If the in blood report it suggests that the cells are macrocytic, then we can identify the patient is experiencing vitamin B12 deficient anemia. So we can, through this blood report, we can identify the difference between the types of anemia and other nutritional deficiency. These 2 points are suggesting you this. Now got my point? Yes or no?
Yes, ma'am.
Other students? Khaba padi?
Yes, ma'am.
Yes, ma'am.
Okay. Next study is evaluating protein balance. How you will identify the protein balance of a person. So, short-term protein status is best determined by evaluating retinol binding protein, prealbumin, transferrin, creatinine, and BUN levels. These are the blood tests through which we can identify a short-term protein status. That right now, just for example, there are two types of blood test for identifying the glucose level, FBS and HbA1c. FBS is a short term status and HbA1c is a long term status. So similarly, to identify the protein status, it is defined divided into two types, that is short term protein status and long term protein status. How to get know about short term protein status? So the tests are retinol binding protein, prealbumin test, transferrin test, creatinine test, and BUN test. Through this test, you can identify the short term protein status of a person. Long-term protein status can be determined by evaluating serum albumin level. If you will check the serum albumin of a person, you can identify the long-term protein status, that this much amount of protein is maintained in an individual's body. Nitrogen balance is evaluated by measuring the urea in the urine, which provides the information regarding the protein loss. If you will test the urine for the urea is also present in urine also. So if you will test the urea in the urine, through this information, you can get the idea about protein loss. The nitrogen balance can be identified through the urea in the urine test. Understood? These are the three methods of evaluating the protein balance, short term and long term. There are different kinds of blood tests through which you can identify the protein status of a person. Understood? Why you are not responding? ऊपर से जा रहा है कुछ? You can tell me. Yes or no? Online students, please speak something. Are you getting any problem in understanding?
No, ma'am.
Okay. Yes. Next is serum electrolyte. So there are various types of blood tests to identify the serum electrolyte balance. Serum sodium, serum potassium. Through that blood test, we can identify the level of electrolytes that we have already studied in chapter 8. The red point that you have to remember is always assess the client's ability to eat and swallow and promote independence in eating as much as is possible. You have to always assess the client's ability to eat or swallow. If the patient is not able to eat or not able to swallow, you cannot provide such kind of food. For example, the patient does not have teeth, so you cannot provide hard food to that patient. The patient cannot eat. Patient cannot chew that. If the patient has difficulty in swallowing, you cannot provide semi-solid or solid food. You have to compulsorily provide the liquid food, semi-thick fluid. So depending on the client's ability, you have to give the food. You have to provide the nutrition. So always assess the client's ability to eat and swallow and promote the independence in eating as much as is possible. You do not have to feed the client every time. If the client can feed by himself, you have to make the client independent. You have to promote the independence. Let the client do it for himself. Okay. Okay, next is dietary guidelines 2020 to 2025. The dietary guidelines for the Americans. There is a one association which has provided the guidelines how your plate should be, how much food you have to consume, just like that. The dietary guidelines for the Americans are designed by the nutritional and health professionals to assist all individuals and their families in consuming health nutritionally adequate diet. ये जो न्यूट्रिशनल और हेल्थ प्रोफेशनल्स हैं उन्होंने मिलकर एक डाइटरी गाइडलाइंस बनाई है फॉर द अमेरिकन जो अमेरिका में रहते हैं एंड ऑल इंडिविजुअल्स शुड फॉलो दिस गाइडलाइंस जिसकी वजह से उनको प्रॉपर हेल्दी और न्यूट्रिशनली एडिक्वेट डाइट मिल सकता है द गाइडलाइंस सी द गाइडलाइंस फॉर द अमेरिकन एट दिस वेबसाइट ये जो वेबसाइट है ये जो लिंक है उस पर आप गाइडलाइंस चेक कर सकते हो आपको मिल जाएगी कि कौन सी गाइडलाइंस कितना कार्बोहाइड्रेट कितना प्रोटीन कितना फैट कितने विटामिन कैसे लेना है क्या करना है सो देर इज वन फिगर दैट इज चूज माई प्लेट .gov माई प्लेट इट इज गिवन एज माई प्लेट तो माई प्लेट हमारी प्लेट कैसी होनी चाहिए दिस मच प्रपोर्शन ऑफ फ्रूट्स दिस मच प्रपोर्शन ऑफ ऑरेंज जो प्रपोर्शन दिख रहा है दिस मच प्रपोर्शन ऑफ ग्रेन्स जो ग्रीन है this much proportion of vegetables and this much proportion of proteins and last is dairy so all things are included fruits and vegetables में हमसे हमें कार्बोहाइड्रेट्स मिल जाएगा प्रोटीन मिलेगा डेयरी में से फैटी एसेंशियल फैटी एसिड्स सब कुछ इसमें मिल जाएगा तो अ प्लेट शुड बी लाइक दिस इतना फूड होना ही चाहिए रेगुलरली टू गेट द प्रॉपर न्यूट्रिशनल adequate nutrition to the body so this is the my plate which is designed by the professionals for the Americans these are the guidelines for the Americans and you have to follow all these guidelines it provides a description of a balanced diet that includes grains vegetables fruits dairy products and proteins yes we can see that the guidelines provides us the information how much amount of fruits vegetables grains proteins and dairy products should be in our plate and the link is given below a nutritionist should be consulted for individualized dietary recommendation see box 11.3 for the nutrition throughout the growth and development yes whenever we are treating a person to meet the dietary necessities of that person a nutritional or nutritionist or dietitian will always require they will identify that how much nutrition or what kind of food we have to give to the patient so there must be a nutritionist for the individualized dietary recommendation and let's see the box 11.3 for the nutrition throughout the growth and development through infancy what type of nutrition infant should be given through in toddler and preschooler age what type of nutrition should they get in school age in adolescent young middle age pregnancy during breastfeeding and older adults so let's see the nutrition what type of nutrition we have to provide to those clients so for infant the American Academy of Pediatrics recommends the breastfeeding for the first 6 months of life and breastfeeding with additional food from 6 to 12 months. The average 1 month old infant consumes approximately 18 to 21 ounce of milk or formula per day. जो ये अमेरिकन एकेडमी ऑफ पीडियाट्रिक्स है उन्होंने रेकमेंडेशंस दिया है कि इन्फेंट को कैसे फीड करना है उनका न्यूट्रिशनल स्टेटस कैसे मीट करना है सो दे आर टेलिंग कि फर्स्ट 6 मंथ्स ऑफ लाइफ है उसमें सिर्फ ब्रेस्ट फीडिंग ही कराना है उससे ज्यादा कुछ नहीं between 6 to 12 months the infant should be breastfed and additional foods that is the weaning diet जब इन्फेंट की एज 6 मंथ्स या 12 मंथ्स के बीच में हो तब उसको ब्रेस्ट फीडिंग कराना है और एडिशनल फूड आप दे सकते हो एवरेज 1 मंथ ओल्ड इन्फेंट जब भी कोई बेबी बॉर्न होता है और 1 मंथ का हो तो एवरेज 1 मंथ ओल्ड इन्फेंट कितना फूड कंज्यूम कर सकता है सो इट कैन डेली कंज्यूम 18 to 21 ounces of milk और अगर मिल्क नहीं और आप फॉर्मूला फीड कर रहे हो तो उतना 18 to 21 ounces ऑफ फॉर्मूला फीड पर डे. व्हाट ounces in ml कितना होगा? The unit they use, that is ounce, but unit that we use, that is ml. So it is roughly around 550 to 650 ml a day. So 1 month old child needs 550 to 650 ml of milk or formula feed. Introduce new food one at a time, 4 to 7 days apart to identify the allergies. This is something important. जब भी जो चाइल्ड है वो 6 मंथ्स का हो जाता है तो हम वीनिंग डाइट स्टार्ट करते हैं, न्यू फूड्स इंट्रोड्यूस कराते हैं. पर एक टाइम पे एक ही फूड इंट्रोड्यूस करना है और एक फूड इंट्रोड्यूस करने के बाद 4 से 7 दिन की गैप रखनी है दूसरा फूड इंट्रोड्यूस करने से पहले बीच में. So through this we can identify the allergies. For example, the child is 6 months old and his mother has decided to start the weaning diet. फर्स्ट मदर ने कुछ खिलाया लाइक कोई वेजिटेबल लाइक कैरेट्स बॉईल करके चाइल्ड को खिला दिए. और सेकेंड डे मदर ने कुछ और खिलाया, नेक्स्ट वेजिटेबल व्हाट वी कैन से दैट इज कॉलीफ्लावर. और चाइल्ड को एलर्जी हो गई तो मदर को कैसे पता चलेगा कि चाइल्ड को कैरेट की एलर्जी हुई कि कॉलीफ्लावर की? सो टू identify the allergies of any food items, there should be a gap of 4 to 7 days between two new food items. For example, आज मैंने कैरोट इंट्रोड्यूस किया है तो मैं 4 to 7 days तक कैरोट ही दूंगी और कुछ नहीं, to identify the child is allergic or not, and then after 4 to 7 days मैं कुछ new food introduce करूंगी और तब एलर्जी होगी तो मुझे पता चलेगा it is not due to carrot, it is due to cauliflower. Got my point?
Yes, ma'am.
Yes, ma'am.
Yes. Infant should not have cow's milk before the age of 1 year. कोई भी चाइल्ड हो जो न्यू बॉर्न हो, इन्फेंट हो, उसको 1 year से पहले काउज मिल्क नहीं दे सकते. The only milk the infant should be given is only mother's milk. Yes, breast milk, cow milk नहीं देना है child को. Children under 1 year of age should not ingest honey or corn syrup products due to the risk of botulism toxin. इट इज अ कल्चर दैट कोई भी न्यू बॉर्न बेबी जब बॉर्न होता है तो उसको हनी ऐसे टेस्ट कराते हैं, बट इट इज रॉन्ग प्रैक्टिस. 1 year से कम एज की कम हो अगर उसकी एज तो उसे हनी और कॉर्न सिरप दैट इज ऑल्सो स्वीट कुछ भी टेस्ट नहीं कराना है. अगर टेस्ट कराओगे तो उससे बॉट्यूलिज्म का रिस्क बढ़ जाता है. सो वी हैव टू अवॉइड द इंजेक्शन ऑफ हनी और कॉर्न सिरप अंडर द 1 year एज ऑफ infant. Understood?
Yeah.
Okay. Next is for toddlers and preschoolers. Yes, it is. Yes, it is a neurological disorder. Okay. Next is toddlers. So let's see the nutritional need for the toddlers. Milk is a poor source of iron, and the children who consume more than 24 ounces of milk per day are at risk for developing milk anemia. The point is telling us कि मिल्क में से आयरन नहीं मिलता. दैट इज अ पुअर सोर्स ऑफ आयरन. आयरन थोड़ा प्रपोर्शन में होगा बट इट इज नॉट गुड सोर्स. और जो भी चाइल्ड 24 ounces से ज्यादा मिल्क पीता है इन अ डे, देयर इज अ रिस्क फॉर डेवलपिंग द मिल्क अनेमिया. जो मिल्क ज्यादा कंज्यूम करते हैं ना वो चाइल्ड अनेमिक होते हैं बिकॉज it does not provide the iron source for the blood production. So anemic होता है वो child. Whole milk should be consumed until 2 years of age to ensure adequate fatty acid intake. Whole milk that is not skim milk. Skim milk किसको बोलेंगे हम? Any idea? Skim milk is
ફેટ રિમૂવ કરી દે.
yes. Whenever we boil the milk and we remove the fat, it is called as skim milk. But जो भी child है उसको whole milk देना है, उसमें से फैट रिमूव नहीं करना है. होल मिल्क शुड बी गिवन टू अ चाइल्ड ओनली अप टू 2 years. 2 years से ज्यादा हमें देने की जरूरत ही नहीं है बिकॉज जितना ज्यादा चाइल्ड दूध पिएगा उसको अनेमिक रह जाएगा. सो 2 years till 2 years we can give the whole milk. Through that whole milk the child will get the fatty acid, essential fatty acid जो adequate fatty acid intake होना चाहिए वो उसे दूध में से मिल जाएगा. Avoid food that pose choking hazards such as hot dogs, candy, nuts, grapes, popcorn, and raw vegetables. Yes, the child is toddler. The toddler will put everything in the mouth. So we have to avoid that foods that can choke the child. चोकिंग हैजर्ड्स जिससे हो वैसा फूड नहीं देना है. जो भी सर्कुलर फूड हो लाइक ग्रेप्स, हॉट डॉग्स पर सर्कुलर शेप में कट किया हुआ. हॉट डॉग लॉन्ग आता है पर हम कट करके ऐसे सर्कल्स कट कर दे तो वैसा फूड नहीं देना है चाइल्ड को, टॉडलर्स को. कैंडीज है, नट्स है, ग्रेप्स, पॉपकॉर्न एंड रॉ वेजिटेबल्स लाइक स्मॉल वेजिटेबल्स, पीज एंड एवरीथिंग. The toddler can get choked due to such kind of vegetables, so we have to avoid these foods. Serving finger food to the toddlers allow them to eat by themselves and to satisfy their need for independence and control. Yes, we know that we can provide finger food to the toddlers. What is that finger food means? Yes, the toddler will play and we will give the food in the fingers of the toddlers. So while playing, the toddler can eat the food by themselves. This maintains the independence and provides satisfaction to the toddler. Nutritional requirement for the preschoolers are similar to those of toddler. Now, जो preschoolers है, उनकी nutritional need toddler से similar ही है. The average daily intake is 1800 calories. Preschoolers को कितनी energy चाहिए, कितनी calories लेनी चाहिए daily? 1800 calories उसको मिलनी चाहिए. Finicky eating habits are characteristic of 4-year-old child. Please mute yourselves. Okay. Finicky eating habits are characteristic of a 4-year-old. Engaging preschoolers in meal preparation will promote the likelihood of their trying new foods. जो भी preschoolers होते हैं वो finicky eating habits वाले होते हैं. Finicky eating habits means picky होते हैं. ये अच्छा लगता है, ये अच्छा नहीं लगता. Without any reason, they will not consume everything. उनको नहीं पसंद आएगा तो वो नहीं खाएंगे. They are very picky in eating the foods. So 4-year-old चाइल्ड में फिनिकी हैबिट्स हमें देखने को मिलती है. वो सारे छोटे बच्चे ऐसे ही होते हैं. So what we can do, we can engage the preschoolers in meal preparations. Like we can ask them what you will like to have in dinner, in lunch. So they will tell you कि I want to have this. So you can engage them in the meal preparation. उससे क्या होगा, वो नया नया फूड ट्राई करने की सोचेंगे कि लेट्स ट्राई दिस. यू विल एंगेज देम कि ये ट्राई करते हैं कैसा लगेगा. तो जो फिनिकी ईटिंग हैबिट्स है उससे हम ओवरकम कर पाए. So this is the nutritional need for toddlers and preschoolers. Next is school age child. So children in this age group have better appetites with a more varied intake. Assess for adequate intake of protein, vitamin A and vitamin C. अब ये जो स्कूल एज चाइल्ड है उनकी अभी एपेटाइट अच्छी हो गई है. अभी वो अच्छा खाना खा सकते हैं और उनका वैरायटी ऑफ इंटेक भी बढ़ गया है. लाइक पहले वो चाइल्ड फिनिकी ईटिंग वाला था, सब कुछ नहीं खाता था. अब ये सारा कुछ ट्राई करेंगे, सब कुछ खाएंगे. वैरायटी इनकी इंक्रीज हो गई है. सो यू हैव टू ऑलवेज असेस द एडिक्वेट इंटेक. स्कूल एज चाइल्ड हो उसका प्रोटीन नीड, जो प्रोटीन नीड्स है बॉडी की वो मीट हो रही है कि नहीं, विटामिन ए प्रॉपरली मिल रहा है, विटामिन सी प्रॉपरली मिल रहा है. you have to assess all these things whether the child is getting adequate intake of protein, vitamin A and vitamin C. This age group is at risk for high intake of fat, sugar, salt related to snacks food. जो स्कूल एज चाइल्ड है उसमें रिस्क क्या ज्यादा है, वो फैट बहुत ज्यादा कंज्यूम करेंगे बिकॉज उनको अभी फास्ट फूड बहुत ही खाना है. शुगर्स लाइक केक्स एंड चॉकलेट्स एंड पेस्ट्रीज वो बहुत ज्यादा कंज्यूम करते हैं. सो देर इज अ रिस्क दैट दे आर टेकिंग हाई इंटेक ऑफ फैट, शुगर एंड सॉल्ट. वाई? बिकॉज ऑफ पैकेज फूड. वो स्नैक्स बहुत ज्यादा खाते हैं, पैकेज फूड बहुत ज्यादा खाते हैं. तो इसकी वजह से ये रिस्क होता है. डेंटल कैरीज, there is also risk of dental caries in this child. Childhood obesity is concern which leads to serious health problems such as diabetes and cardiovascular disease. A potential for psychological problem is also a concern. Promote healthy lifestyle habits including nutrition programs, encourage physical activity. अभी स्कूल एज वाला चाइल्ड है उसकी ईटिंग हैबिट्स अभी से ही खराब हो जाएगी सो चाइल्डहुड ओबेसिटी हमें देखने को मिलेगी। हमने कितने भी चाइल्ड ऐसे देखे होंगे जो बचपन से ही ओबेस होते हैं। व्हाई? बिकॉज देयर ईटिंग हैबिट इज वेरी पुअर, दे आर ऑलवेज इंडल्ज इनटू द ईटिंग जंक फूड। सो चाइल्डहुड ओबेसिटी हमको देखने की मिलेगी, और विच कैन लीड टू सीरियस हेल्थ प्रॉब्लम्स। उनको अर्ली एज में डायबिटीज हो जाएगा, अर्ली एज में कार्डियोवेस्कुलर प्रॉब्लम्स हो जाएंगे, और ड्यू टू द ओबेसिटी साइकोलॉजिकल प्रॉब्लम्स भी दिखने को मिलेंगे, ईटिंग डिसऑर्डर्स देखने को मिलेंगे। लाइक which are the eating
Pica,
disorders?
Bulimia, bulimia nervosa.
Yes.
bulimia nervosa, bulimia,
Yes, bulimia nervosa,
anorexia, no,
yes, anorexia nervosa, and
pica,
there is third another kind of eating disorders. What was that? एक में चाइल्ड जो भी पर्सन होता है वो खाता नहीं है, दूसरे में ज्यादा खाता है, और तीसरे में खाकर इंड्यूस वॉमिटिंग करता है। So there are three types of that. Which are that? Now tell me.
overeating, compulsive overeating.
Yes, one is compulsive overeating, one is anorexia nervosa, and one is bulimia nervosa. There are three types of eating disorders. So psychological problems भी हमें देखने को मिलेंगे. So we have to promote the healthy lifestyle habits in a school age child. हम अभी से ही healthy lifestyle habits उसमें develop करेंगे, तो that would be beneficial for child in the later phases of life. Like न्यूट्रिशन प्रोग्राम्स और फिजिकल एक्टिविटी भी उन्हें ज्यादा करानी है। सो दिस कैन यू कैन डू दिस इन अ स्कूल एज चाइल्ड। नेक्स्ट इज एडोलेसेंट। एडोलेसेंट में न्यूट्रिशनल नीड कैसी होनी चाहिए? सो एनर्जी नीड्स इंक्रीजेस टू मीट द इंक्रीज मेटाबॉलिक नीड्स ऑफ ग्रोथ। अभी जब एडोलेसेंट फेज में आ जाएगा कोई भी पर्सन, सो उसकी मेटाबॉलिक नीड्स ज्यादा होगी, बिकॉज नाउ द ग्रोथ विल स्टार्ट. So the energy will also require more by that person. So we have to provide more energy food to adolescent age group. This age group has increased requirement of daily protein, calcium for the bone growth, and iron to replace the menstrual losses and to promote the muscle development. अभी adolescent age में हमने देखा कि beard भी आना start हो जाएगी, muscle gain भी start होगा in the adolescent phase. So इस ग्रुप को प्रोटीन की रिक्वायरमेंट ज्यादा है और कैल्शियम की रिक्वायरमेंट ज्यादा है बिकॉज ऑफ मसल बिल्डिंग एंड बोन ग्रोथ. जो फीमेल्स है उसको आयरन भी देना पड़ेगा ड्यू टू द मेंस्ट्रुअल लॉसेस. अब फीमेल्स को मेंस्ट्रुएशन भी स्टार्ट हो जाएगा एडोलेसेंट में. सो यू हैव टू प्रोवाइड ऑल दीज थिंग्स. Increased intake of iodine and B complex vitamins is necessary to support the thyroid development and metabolism. अभी adolescent age में सब कुछ डेवलप होना स्टार्ट होगा. सो आपको आयोडीन और ऑल द विटामिन बी कॉम्प्लेक्सेस है वो सब प्रॉपरली देना होगा, उसका इंटेक ज्यादा करना होगा, तो उससे ज्यादा अच्छे से थायराइड डेवलपमेंट होगा, उनकी बॉडी में प्रॉपर मेटाबॉलिज्म स्टार्ट होगा. बिकॉज थायराइड अगर प्रॉपर डेवलप नहीं होगा तो मेटाबॉलिज्म अफेक्ट हो जाएगा. Fast food consumption is common and puts the adolescent at risk of malnutrition and obesity. Adolescent में भी fast food consumption बहुत ही common है. So उसकी वजह से उनको रिस्क है malnutrition का और obesity का. So you have to take care of this also. The onset of eating disorders commonly occurs during adolescent. स्कूल एज में उसकी ईटिंग हैबिट खराब थी, पर अभी ईटिंग डिसऑर्डर्स कब स्टार्ट होगी? ड्यूरिंग एडोलेसेंस, बिकॉज ऑफ बॉडी शेमिंग इन दिस एज ग्रुप. स्कूल एज में उतना बॉडी शेमिंग उनको अफेक्ट नहीं करेगा, बट व्हेनेवर दे रीच टू द एडोलेसेंट एज ग्रुप द बॉडी शेमिंग विल अफेक्ट देम मोर, and due to that the eating disorders will start at the adolescent period. So this is also common in adolescent age group, so you have to also monitor for this all. Next is young and middle adults. So they are not adolescent, they are young adults. So energy need decreases as the growth period ends. We know after certain age our growth stops. So now the energy needs decreases because the growth period has end. Lack of physical activity and access to certain food increases the risk of obesity and insulin resistance and other health problems such as cardiovascular disease. अगर कोई भी पर्सन यंग एडल्ट और मिडल एडल्ट में है और वो प्रॉपर फिजिकल एक्टिविटी नहीं कर रहा है, लैक ऑफ फिजिकल एक्टिविटी से क्या होगा? लैक ऑफ फिजिकल एक्टिविटी भी है, और ऐसे सर्टेन फूड्स वो खा रहा है, सो उससे इंक्रीज रिस्क ऑफ ओबेसिटी, ओबेसिटी का रिस्क बढ़ जाएगा, इंसुलिन रेजिस्टेंस हो जाएगा, इंसुलिन रेजिस्टेंस की वजह से डायबिटीज हो सकता है, और अदर प्रॉब्लम्स भी हो सकते हैं लाइक कार्डियोवैस्कुलर डिजीजेस. Women who use oral contraceptives often need extra vitamins. जो भी फीमेल्स, जो एडल्ट फीमेल्स है, वो ओरल कॉन्ट्रासेप्टिव्स यूज कर रही है, तो उसको एक्स्ट्रा विटामिन की जरूरत पड़ेगी. वाई? बिकॉज जो विटामिन एब्जॉर्प्शन है वो डिक्रीज हो गया है. टू गेट द मोर विटामिन, द फीमेल मस्ट कंज्यूम एक्स्ट्रा विटामिन, कि जिसकी वजह से नॉर्मल एब्जॉर्प्शन हो सके. आयरन एंड कैल्शियम इंटेक आर इम्पोर्टेंट कंपोनेंट्स ऑफ द डाइट. जो भी यंग और मिडल एडल्ट्स है, उनका आयरन और कैल्शियम इंटेक है वो बहुत इंपॉर्टेंट है. उनको आयरन और कैल्शियम प्रॉपरली लेना ही होगा, स्पेसिफिकली फॉर द फीमेल्स. Next is pregnancy period. During pregnancy period, what we have to make sure that during pregnancy, protein requirement increases to 90 to 60 grams per day. नॉर्मल जो इंटेक होता है प्रोटीन का, उससे 60 ग्राम्स ज्यादा बढ़ जाता है ड्यूरिंग प्रेगनेंसी. वाई? Because during pregnancy the metabolism increases, so all the dietary requirement also increases. Calcium needs increases to promote the fetal bone mineralization. फीटस जो अंदर डेवलप हो रहा है मदर के अंदर, उसका बोन का ग्रोथ के, उसके बोन के ग्रोथ के लिए मदर को कैल्शियम भी ज्यादा लेना होगा. आयरन सप्लीमेंट्स सपोर्ट इंक्रीज ब्लड वॉल्यूम. आयरन के सप्लीमेंट्स भी मदर को बढ़ाने होंगे, उसको लेना ही पड़ेगा मदर को ड्यूरिंग प्रेगनेंसी. एंड फॉलिक एसिड इंटेक इज रिक्वायर्ड फॉर डीएनए सिंथेसिस एंड रेड ब्लड सेल प्रोडक्शन. बिकॉज फीटस को भी अभी प्रॉपर ब्लड वॉल्यूम चाहिए, मदर की भी डिमांड बढ़ गई है ड्यू टू टू लाइव्स. सो आयरन सप्लीमेंट डोज भी इंक्रीज करना होगा, फॉलिक एसिड इंटेक भी इंक्रीज करना होगा. सो ऑल दिस आर नीड्स मस्ट बी मेट ड्यूरिंग द प्रेगनेंसी. Next, the mother is breastfeeding or chest feeding. During that, what we have to keep in mind, encourage intake of protein, calcium and vitamin A, B and C. Promote adequate fluid intake. अभी मदर को प्रोटीन, कैल्शियम और विटामिन ए, बी एंड सी सबका इंटेक बढ़ाना होगा, एनकरेज करना होगा. मदर को बोलना होगा कि फ्लूइड इंटेक भी आप ज्यादा कर दो. कंज्यूम एन एडिशनल 500 किलो कैलोरीज पर डे टू सपोर्ट एडिक्वेट प्रोडक्शन ऑफ ब्रेस्ट मिल्क. मदर को एक्स्ट्रा 500 किलो कैलोरीज एक्स्ट्रा लगेगी, एडिशनल. जितना वो खाती है उससे 500 किलो कैलोरीज ज्यादा. ज्यादा लेने से क्या होगा कि जो ब्रेस्ट मिल्क है वो प्रॉपर एडिक्वेट प्रोडक्शन होगा. अगर मदर ही प्रॉपर नहीं कंज्यूम करेगी फूड, सो ब्रेस्ट मिल्क प्रोडक्शन ही नहीं होगा और बेबी को कैसे सपोर्ट होगा. सो एडिशनल 500 किलो कैलोरीज इज रिक्वायर्ड बाय अ मदर who is breastfeeding. Avoid alcohol, caffeine and certain drugs as these are absorbed into milk. हमें मदर को एडवाइस करना होगा कि आपको अल्कोहल और कैफीन और सम काइंड्स ऑफ ड्रग्स अवॉइड करने हैं, बिकॉज दिस components can get mixed into the breast milk and can travel to the fetus. So we have to avoid the female, to avoid alcohol, advise the female to avoid alcohol, caffeine and certain drugs. Now last is older adults. During the old age, what type of nutritional need you have to keep in the mind. Energy needs are decreased due to slowed metabolic rate. During older age, the metabolic rate decreases, so the energy need also decreases. Age related changes that affects nutrition include changes in the teeth and saliva production, reduced taste and smell, decreased thirst sensation and decrease the gag reflex. Now, due to the age-related changes, the nutritional status will also get affected. For example, during older age, the patient loses the teeth. So, due to that, the patient cannot consume every kind of food. So, due to the changes in the teeth, salivary production also gets decreases. The reduced sense of taste and smell, decreased thirst sensation. The older adults cannot identify the thirst sensation. The thirst sensation gets reduced in the old age person and decrease the gag reflex. What is gag reflex? New students, what is gag reflex?
Less peristalsis movement.
Sorry, I could only hear peristalsis.
Less peristalsis movement.
No. Old students, what is gag reflex? What is gag reflex in your terms, in your language?
જ્યારે આપણે કોઈ ફૂડ ઇન્જેક્ટ કરીએ ને ત્યારે તે ફેરિંગ્સમાં ના જતું રહે એના માટે તે પ્રોટેક્ટ કરે.
Yes. Gag reflex is a protective mechanism. જ્યારે બી તમે ફિંગર નાખો છો મોંમાં તો કેવું વોમિટિંગ જેવું થાય છે, કેમ થયું? Because of good gag reflex. So in older adults, the gag reflex reduces. So there are increased risk of
એક્સપિરેટ.
aspiration. Yes. So these are the age related changes. So their nutritional need also gets affected due to all these kind of changes. Maintaining a good oral health is very important in older adults. If the individual is taking prescription medications, discourage the consumption of grapefruit and the grapefruit juice because they alter absorption of many medications. We have already studied this in pharmacology that grapefruit interacts with much more medications. So if the older adult is taking any medication, prescribed medications, we have to advise the patient not to consume the grapefruit or its juice, because the grapefruit and grapefruit juice may alter the absorption of many medication and may interact with many medications. Ensure adequate calcium and vitamin D intake to prevent the osteoporosis, especially in the postmenopausal women. We have to give vitamin D intake and calcium intake to the older adults because due to the age, there are chances of fracture due to the osteoporosis. So we have to maintain the adequate intake of calcium and vitamin D in the older adults, especially in the postmenopausal women, because during postmenopausal the women is highly susceptible to get the fracture because of osteoporosis. So this nutritional need you have to keep in mind for the older adults. Any doubt in this?
નો મેમ.
Yes. Okay. So these are the nutritional needs of all the stages of life. Okay. The goal is to adapt a healthful eating pattern at an appropriate calorie level with a variety of nutrient dense food and beverages among all the food groups. What is our main goal by following these dietary guidelines? The main goal is to adapt a healthful eating pattern. अगर हम प्रॉपर डाइटरी गाइडलाइंस फॉलो करेंगे तो उससे बेनिफिट क्या होगा कि हम प्रॉपर ईटिंग पैटर्न्स अडेप्ट कर सके और जो भी कैलोरी लेवल्स है जो रिक्वायर्ड है बॉडी को वो मेंटेन हो सके, अप्रोप्रिएट कैलोरी लेवल्स हम ले सके विथ अ न्यूट्रिएंट डेंस फूड एंड द बेवरेजेस अमंग ऑल फूड ग्रुप्स. My plate is based on 2020-2025 dietary guidelines for American. माई प्लेट जो है, जो हमने इमेज देखा, जो डाइटरी गाइडलाइंस बनाई है, वो किस पर ज्यादा बेस करती है? तो फ्रॉम 2020 to 2025 डाइटरी गाइडलाइंस फॉर द अमेरिकन्स. They usually what we can say, they usually modify these guidelines after certain age. For example, this is for 2025. So after completion of 2025 they will provide new guidelines related to current scenario. For example, in 2000, by the end of 2025, the risk of certain diseases increases and they will include that disease in their guidelines and provide the guidelines according to that. So they will regularly modify their guidelines. So current guidelines is from 2020 to 2020-25. Understood?
Yes.
Now, client teaching. What you have to teach the client regarding the guidelines and everything. So first, find a healthy eating style and regularly eat a variety of food to ensure the consumption of necessary nutrients and calories. We have to advise, we have to teach the client about healthy eating lifestyle. We have to advise the client to adapt the healthy eating styles, and we have to advise the patient to eat variety of foods. Through that, the patient can consume necessary nutrients and calories. जितना फूड ज्यादा अलग अलग फूड कंज्यूम करेगा पेशेंट, उससे उसको सारे न्यूट्रिएंट्स मिलेंगे. Fill half of the plate with fruits and vegetables. We have to teach the client कि आपकी प्लेट में आधी प्लेट तो फ्रूट्स एंड वेजिटेबल्स की ही होगी, जो आधी रिमेनिंग है उसमें ग्रेन्स और प्रोटीन्स आ जाएगा, पर आधी प्लेट तो फ्रूट्स एंड वेजिटेबल्स की ही होनी चाहिए. वराई द टाइप्स ऑफ वेजिटेबल्स एंड फ्रूट्स ईटन. आपको पेशेंट को टीचिंग देना है, एडवाइस करना है कि जो भी आप फ्रूट्स एंड वेजिटेबल्स खा रहे हो उसमें वैरायटी रखो. एक ही फ्रूट रोज के रोज, एक ही फ्रूट एक ही वेजिटेबल नहीं खाना है, उसमें वैरायटी मेंटेन करनी है, तो सारे आपको मिनरल्स एंड इलेक्ट्रोलाइट्स आपको उसमें से मिलते रहेंगे. सिलेक्ट एटलीस्ट हाफ ऑफ द ग्रेन्स एज अ होल ग्रेन. जब हमने माय प्लेट में देखा था कि एक पोर्शन ग्रेन्स का था, तो ग्रेन्स में भी आधे ग्रेन्स हो, वो तो होल ग्रेन्स ही होने चाहिए. सो वी हैव टू एडवाइस दिस टू द पेशेंट. ड्रिंक मिल्क दैट इज फैट फ्री और लो फैट दैट इज 1%. हमें पेशेंट को एडवाइस करना है कि अगर आप मिल्क लेते हो तो मिल्क कैसा होना चाहिए, स्किम्ड मिल्क होना चाहिए, उसमें अभी फैट नहीं होना चाहिए. अभी हमें फैट की जरूरत नहीं है, वो अप टू 2 years हम ले सकते हैं, आफ्टर 2 years हमें फैट की जरूरत नहीं है. सो यू हैव टू ड्रिंक फैट फ्री मिल्क, और लो फैट मिल्क कैन कंज्यूम, लाइक 1% फैट हो तो वो चल सकता है. वराई प्रोटीन कंजप्शन टू इंक्लूड नॉन मीट सोर्सेस. अगर कोई पर्सन लाइक मीट नहीं खा रहा है, वेजिटेरियन है, नॉन मीट सोर्सेस खा रहा है, तो नॉन मीट सोर्सेस के उसको सारे एसेंशियल अमीनो एसिड्स नहीं मिलेंगे. सो हमें उसको बोलना होगा कि प्रोटीन कंजप्शन में भी वैरायटी रखो. लाइक patient will say कि I am taking rajma. Rajma, I am eating rajma. So rajma से मुझे प्रोटीन मिल जाएगा. It is not like that. Along with rajma, you have to eat something else to get all the essential amino acid. If you are not including non-meat source, if you are including non-meat sources, if you are including meat sources, then it is fine. But the person is vegetarian, then the person is advised to eat variety of proteins. Drink and eat beverages and foods with less sodium, saturated fat and added sugar. हमें क्लाइंट को एडवाइस देना है, टीचिंग देना है कि आप जो भी बेवरेजेस, व्हाट इज बेवरेजेस? Beverages. Junk is food. Beverages. Give me one example of beverage.
Cold drinks,
Coke,
coffee.
cold drinks,
So the
tea,
drinkable item,
coffee.
yes, the drinkable item is called as beverages. So we have to advise the patient that जो भी आप beverages ले रहे हो और food ले रहे हो, उसमें सोडियम कम होना चाहिए, सैचुरेटेड फैट भी कम होना चाहिए, और एडेड शुगर्स भी कम होना चाहिए. दिस इज नॉट गुड थिंग. ड्रिंक वाटर इंस्टेड ऑफ शुगरी ड्रिंक्स. अगर आपको प्यास लगी हो और आप कहीं पे खाना खा रहे हो तो पानी पियो इंस्टेड ऑफ शुगरी ड्रिंक्स. शुगरी ड्रिंक्स से आपका शुगर लेवल ही स्पाइक होगा, आपको कुछ बेनिफिट नहीं होगा. द इम्पोर्टेंट पॉइंट दैट यू हैव टू टीच टू द क्लाइंट इज, or you have to keep in mind is, always consider a client's cultural and spiritual and personal choices when planning a nutritional intake. This is very important. कभी भी आप क्लाइंट को न्यूट्रिशनल इंटेक प्लान कर रहे हो क्लाइंट का, तो उसका कल्चरल एंड स्पिरिचुअल और उसकी पर्सनल चॉइसेस को आपको ध्यान में रखना है. अगर क्लाइंट वेजिटेरियन है तो यू कैन नॉट फोर्स द क्लाइंट टू ईट द चिकन एंड एग्स. इफ द क्लाइंट इज फॉलोइंग सम cultural practices, for example, if the client in India, we can say, if the client is following Jainism or Buddhism or Swaminarayan, so we cannot offer them onion and garlic. So you have to always keep the cultural and spiritual and personal choices of the client before planning nutritional intake. Understood?
Yes, ma'am.
Okay, so from therapeutic diets we will see tomorrow. Let's do a quick revision of our today's class. So today we have started the new chapter, that is nutrition. We have studied all the macronutrients and micronutrients. First we have studied carbohydrate. Carbohydrate is the preferred source of energy, or we can say the first source of energy of the body. Then we have seen fats. Fat is the stored form of energy. Whenever there is lack of carbohydrate, the body will utilize the stored fat as a source of energy. And fat is important for the fat soluble absorption of fat soluble vitamin. Then we have seen proteins. Proteins are divided into two classifications, like complete protein and incomplete protein. Complete protein contains all the essential amino acid in single food, and incomplete protein means a single food does not contain all the amino acids. We have to combine the food to get all the essential amino acids. The important point that you have to remember is, what was that? Childhood, adolescence. Yes. These are the age groups in which the nutritional need must be met very properly. The age groups are pregnancy, lactation, infancy, childhood, and adolescence. These are the lifespans of the age. Through during that, we have to maintain the nutritional needs of a person. Adult and older adults may experience physiological changes and related to the aging that will influence the individual nutritional need. It is not necessary that two same adults or same older adults will require the same kind of nutritional need. It is not like that. But for pregnancy, lactation, infancy, childhood, and adolescent, we have to maintain a specific nutritional need. Then we have seen vitamins. There are mainly two types of vitamins: water soluble vitamins and fat soluble. Which are water soluble vitamins? All
Folic acid,
vitamin
niacin.
B, yes, all vitamin B complexes and vitamin C. These both are water soluble vitamins. What are fat soluble vitamins?
ADEK.
Yes, E, D, E, K. So these are the fat soluble vitamins. You have to remember the sources of each vitamin. You can be asked in examination. Mainly, you have to remember which sources. Let me tell you. Just try to remember folic acid, vitamin B12, vitamin C, vitamin D, vitamin K. These are so important. These are so essential. બીજા યાદ નહીં રહે તો ચાલશે પણ આ તો યાદ રાખવાના છે. ફોલિક એસિડ, વિટામિન B12, વિટામિન C, વિટામિન D, and vitamin K. These are very essential vitamins. You have to remember this. So try to remember all the vitamins, but these are important. You cannot skip these vitamins which I have done a tick mark. Then we have seen minerals and electrolytes. So mainly there are calcium, chloride, iron, magnesium, phosphorus, potassium, sodium, and zinc. You have to identify the food that is source of specific mineral. Like, which are the important minerals that you have to remember it anyhow? Calcium, iron,
Sodium, potassium.
yes, potassium and sodium. These are the important minerals. You have to remember all the food sources through which you can get the specific electrolytes or minerals. Then water. Water is the main source of the body. Then we have seen malnutrition laboratory markers. There are certain lab tests or lab values through which we can identify the nutritional status of a person. In that, first one is hematological studies. Through the blood studies, we can identify the type of anemia or other nutritional deficiencies which is experienced by the patient, by the person. Then next is study for the protein balance. So there are mainly three types of study: short-term protein status, long-term protein status, and nitrogen balance. Short-term protein status we can identify through the blood tests like retinol binding protein, prealbumin, transferrin, creatinine, and BUN. These are the blood tests through which we can identify the short-term protein status. Long-term protein status can be evaluated by the serum albumin levels, and nitrogen balance is identified by the urea in the urine. We have to check the urine test. We have to do the routine urine test, and through which we can identify the nitrogen balance of a person. For electrolytes, we have already studied in chapter 8, that is the electrolyte fluid and electrolyte chapter, that this is the normal range of electrolyte. If it is altered, we can identify that the patient is experiencing some kind of malnutrition. The red point that you have to remember is, what was that?
Check client ability to swallow.
Yes. Before giving the food, we have to always assess the client's ability to eat and swallow. Next, what? Yes, we have to promote the independence of a client in eating as much as it is possible. you cannot make the client dependent on someone for eating. You have to maintain the independence of a client. Next, we have seen 2020 to 2025 dietary guidelines, which are designed by some professional for the Americans. So they are providing my plate guideline. In my plate guidelines, they are telling that this much proportion of fruits should be included in plate, vegetables, grains, and proteins and dairy. Now, half of the plate, the my plate tells us half of the plate should be contain fruits and vegetables. The grains in which half of the grains are must be whole grains and others can be consumed anytime that the patient wants, and this much amount of protein. Dairy, if the patient is taking dairy and if the patient is taking milk, the milk should be fat free. So this is the guidelines that are provided by the dietary guidelines for the Americans. Understood this point?
Yes, ma'am.
Yes, ma'am.
Then we have seen the nutrition throughout the different stages of life. During infancy, what type of food you have to give during toddler and preschool life age group, school age, adolescent, young and middle adults, pregnancy, breastfeeding mothers and older clients. So I will ask you tomorrow, in infancy, what type of kind of nutritional status you have to remember, in toddlers, what you have to remember, in school age, what you have to remember. I'll ask you tomorrow, so just read and come tomorrow. Then client teaching. We have to teach certain things to the client, like advise the client to adapt healthy lifestyle. Then already we have seen that half of the plate should be of fruits and vegetables. Half of the grains that you are consuming should be of whole grains. The milk that you are consuming in the dairy, that must be fat free. Then if the person is vegetarian, the person has to consume variety of proteins, not a single source of protein. Then if the person is taking food or drinking the beverages, it should be in less sodium, saturated fat and sugary added sugars. Advise the person to drink water instead of sugary drinks. And what is the red point that you have to remember is,
ક્લાયન્ટની કલ્ચર, સ્પિરિચ્યુઅલ અને પર્સનલ ચોઇસને ધ્યાનમાં રાખીને ડાયટ પ્રોવાઈડ
yes,
કરવાનું.
you are planning the nutritional intake of a patient, or whenever you are planning for the diet of a patient, always follow the client's cultural, spiritual and personal choices. We have to keep that in mind. Any doubt in this?
No, ma'am.
Okay, so see you tomorrow at 9 a.m. Thank you.
થેન્ક યુ મેમ.
Thank you, ma'am.
Thank you.
થેન્ક યુ.
Thank you.